Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome back. My next guest is Dr. Lane Stafford, who is a radiologist, diagnostic radiologist at Baptist Health. Welcome.
Thanks for having me, Dr. Fox.
All right, now, a lot of times I'll have a patient says, well, I was in the hospital and I got this bill from somebody, maybe they read a film or a radiologist. So you don't always see the patients, but you always do something to help the patient. So tell me a little bit about what a radiologist is.
Sure. So a bill from a doctor you've never met, in other words. Yeah. So as radiologists, they sometimes are referred to as a doctor's doctor. So when your care physician decides that it's time that he has a clinical question that needs answering with imaging, any form of x-ray, CAT scan, MRI, we're the ones who, after the scan is done, take a look at those images and generate a report that helps him to interpret those findings and make any decisions that need to be made from that imaging exam.
And that's real important. It's real important to us as primary care and to the patient too. So you do a great job. But the gold standard is X-ray, I would guess, and that's what we've had for a long time. We've got a lot of other stuff, but tell me what a regular X-ray would look for.
Sure. So when it's time that your doctor decides that there's a question that, again, he wants to answer with a radiology study with imaging, these days there are numerous tools at our disposal. The first thing we want when we choose which tool to use is it going to answer the doctor's question, and is it our quickest, safest, and cheapest option? And X-rays are essentially the oldest exam, and they remain the cheapest and the quickest, and there's still plenty of questions that they can answer. Stuff that we're familiar with. It's still the best study for a broken bone, looking for pneumonia, any number of clinical questions that an X-ray can answer, even though in the 50 years since it became commonplace, we've developed way more high-tech and fancy tools. It still has plenty of use.
Now, you mentioned way more high-tech, so let's talk about some of them. CAT scan is the one that comes to mind next to X-ray. Sure.
CT is CAT scan is kind of the workhorse of radiology, and it's based on a similar type of imaging as an X-ray. So it essentially takes hundreds of quick X-rays at once and puts those together into what can be a two-dimensional or a three-dimensional picture to take a look at specific anatomy in a much more detailed way than an X-ray machine would do.
It's computerized and it is still radiation.
Yes, sir. Yeah, it uses X-rays similarly to an X-ray machine. Okay.
Now, an MRI, is that different?
So there's no radiation involved with an MRI, which makes it safer. But similar process that a patient's going to go through. It just takes a lot longer. It's a newer technology, and in a lot of cases has a much higher degree of diagnostic accuracy than a CT scan might. So it's if the CT scan is the workhorse, the MRI might be the more time-consuming and expensive specialist beyond the workhorse of CT if there's a question that still needs answered.
Now, some people, it used to be it was a tight space to get into. Have they improved that a little?
Unfortunately, there are options out there for what they call open MRI, and the quality of those is improving. The gold standard is still going to involve being in a tight, noisy space. And so when we talk about kind of the cost and the things that we consider, there are a lot of folks who understandably can't tolerate an MRI, and we do everything we can to make them comfortable, and we've got videos and headphones and even folks who take some medication, but it's definitely one of the things to consider when you're looking at an MRI still.
Now, you said MRI might be a little safer because of the radiation, but ultrasound is also, I mean, that's sound waves, correct?
Yes, sir, and that's another tool that's been around forever. Very inexpensive, usually pretty accessible. A lot of docs have them in their office, so ultrasound can be a great and sometimes underutilized tool to answer a lot of questions.
Is that safer in kids?
Absolutely. So as it doesn't involve any radiation at all, virtually no risk profile to an ultrasound. So it's a good option in kids.
Now, the other end of the spectrum is more radiation, more invasive, things like arteriograms.
Sure. So specific pictures, if we're talking about aneurysms or atherosclerosis, blockages in arteries, there are special exams where a radiologist like myself, or potentially what you would refer to as an interventional radiologist, places a catheter into an artery, sort of like starting an IV as if you were getting an IV medication, and injects a specific kind of contrast while they take a live picture of the blood vessels as that contrast goes through. And that's a relatively older tool, but remains the best when it comes to diagnosing specific conditions of blood vessels.
And use the term interventional radiologist, they can also do any treatment at the time, or are they just more aggressive in terms of testing?
Sure. So I would be what you would refer to as a diagnostic radiologist. So I spend most of my day looking at pictures and generating reports on your CAT scan, on your X-ray, on your MRI. An interventional radiologist does more of the procedures that use imaging to go along with them. So if on your CT scan we found something in your lungs that requires a biopsy, and we want to have a CT scan at the ready when we go to do that biopsy, the interventional radiologist would be the one looking at his needle, looking at the CT scan or the X-ray to make sure that he's in the right spot to biopsy your lung finding.
Well, thanks for all the information. Thanks for coming in and telling us about it, and for all the care that you give the patients.
Absolutely.
We appreciate it.
Thank you, Dr. Fox.
We'll be right back.